First of all, I want to thank y'all for coming and supporting me, listening to my speech. I'm going to talk about a disease that cripples people, such as rheumatoid arthritis. According to MayoClinic.org, rheumatoid arthritis is an inflammatory disease that causes inflammation to the joints. Sometimes can cause things to the lungs, eyes, heart, and even blood vessels. When someone has this autoimmune disease, it is very painful. This disease basically attacks its own body tissue, which results in bone erosion and deformity of the joints. In this disease, more women are diagnosed with it than men, probably because we can handle more pain than they can. Some of the common symptoms with this rheumatoid arthritis is joint pain, joint swelling, joint stiffness, of course, inflammation and pain. When first getting diagnosed with this disease, the doctor will do a simple physical exam such as range of motion, checking for any redness or swelling around the joints. If they feel that you do have this autoimmune disorder, they will do extensive blood work to, to make sure that you do have this disease so they can start treatment as early as possible. Some of the treatments that they do are things such as DMARDs, which are basically, it's called disease modifying anti-rheumatoid, I can't remember the name, let me see real quick. Drugs, and some of these are methotrexate and plaquenil. Those are the most common ones. They also have biologics. Those are injectables, which sometimes people give themselves injections at home, or they have to go into an office and do IV treatment. Some of these medications are Humira, Orencia, Symphony, and Embryo. Another type of medication is, they're called NSAIDs, and those are non-steroid medications such as Aleve and Motrin. Some of the other options that people tend to do are changing diet, which is eliminating gluten, processed foods, red meat, sugars, and fried foods. I have tried this diet myself, and it actually does help. It's just hard to keep up with because of all the tasty foods out there. But it is one of the options to help with all the inflammation and the swelling. Another type of treatment is eating the right foods, which are fishes such as tuna, salmon, and sardines. Eating your nuts, your fruits and vegetables that are rich in antioxidants, and whole grains, green teas, beans, peas. Those are all the foods that you should be eating, as well as doing light exercise. Some of the exercise that I do is basically walking from wherever I need to go, because the exercise does not do well with my joints. It causes more pain than anything else. Another treatment that you can do is resting as much as possible, whenever possible, and kind of stay stress-free, because that does cause inflammation. Now that you know some of the signs and symptoms of this disease, If you ever have any, I suggest you get checked as soon as possible to get the right treatment. Once again, thank you for coming and listening to my speech.